we don't have something pre-identified that, as far as a target, saying this is when we're going to recommend not wearing masks in public. I think there's still a lot of unknowns, and as you know, we're going into the winter months, and fortunately, masks also prevent against transmission of flu and RSV and other respiratory diseases.
Masking's gone away, to your point, and yet it was statistically significant on the difference it made with flu, as Dr. Wendelboe just mentioned, certainly with COVID.
In terms of directly the question about whether to wear masks in public or not, I would say our society is divided into two camps. If you're in the camp of having been vaccinated and your vaccine is in effect, then you're wearing a mask to prevent transmission primarily, and you're largely protected against hospitalization and death. And so that population has a different risk threshold, I think, in not wearing a mask versus the unpopulated group, which, as you just saw, has a 50x increase in risk of hospitalization and death, or at least a 50x increase in risk of death. And so that means that if I were unvaccinated, I'd be wearing a mask pretty much everywhere.
Yeah.
As the sort of panel's advocate for children, I would like to speak up here and say that our children under 12 aren't vaccinated yet. And so one of the reasons I continue to wear a mask is because I don't want to be growing the virus in my nose without having symptoms and give it to somebody's child, and then they pass it on to the grandparent who's vulnerable or immune compromised. So it's kind of a hassle, sure, but the stakes are high for our young ones and our immunocompromised folks.
We really mask out of respect for others. That's what we care about. That's why we're in healthcare, is we care about other people, and that's why we mask.